Welcome back. Today we're diving into a topic that's literally at your fingertips, what your nails reveal about your health. We spend time making our nails look good, but have you ever wondered what they're telling you about your body? Your nails can show signs of everything from vitamin deficiencies to serious health conditions. We'll break down 7 nail signs you should know. Think of it as a mini health check you can do anytime. This isn't about alarm, but about empowering you with knowledge. Let's jump into the first clue and start decoding what your nails are saying. All right, let's dive in. First up, pale nails. What could they be telling us? If you glance down and your nail beds look unusually pale, almost white, it's time to pay close attention. This isn't just about aesthetics. It's a potential signal from your body that something might be amiss. We're talking about a noticeable difference from the healthy pink hue we typically associate with well-oxygenated blood flow. This paleness can be a key indicator of anemia. But what exactly is anemia? Anemia means your body isn't getting enough oxygen-rich blood circulating throughout. Red blood cells are responsible for carrying oxygen, and when their numbers are low or they aren't functioning correctly, your tissues and organs suffer. This lack of oxygen delivery can manifest in various ways, and pale nails are just one visible clue. Anemia often comes hand in hand with other symptoms like persistent fatigue, making you feel drained even after rest, or shortness of breath, even with minimal exertion. You might also experience dizziness, headaches, or a general feeling of weakness. So, if you notice these symptoms alongside pale nails, it's a good idea to get your iron levels checked. Iron deficiency is a common cause of anemia, and a simple blood test can determine if you're lacking this essential mineral. Addressing iron deficiency through diet or supplements can often resolve the issue. But it's not just iron we're talking about. While iron deficiency is a primary suspect, other vitamin deficiencies like B12 or folate can also contribute to anemia and consequently pale nails. Pale nails can also point to more serious underlying conditions, such as liver disease or even heart failure. These conditions can disrupt the body's ability to produce or effectively circulate blood. Both liver disease and heart failure can significantly affect blood flow and overall tissue health. When the liver isn't functioning properly, it can impact the production of proteins essential for blood clotting. Similarly, a weakened heart struggles to pump blood efficiently, leading to reduced oxygen delivery to the extremities, including the nail beds. Malnutrition is another potential culprit behind pale nails. Your nails, like every other part of your body, need a steady supply of protein, vitamins, and minerals to stay healthy and maintain their normal color. A diet lacking in essential nutrients can lead to various nail abnormalities, including paleness. Here's a quick test you can try at home. Gently press on your nail bed. When you press, it should turn white due to the temporary interruption of blood flow. Then, when you release the pressure, it should quickly return to its normal pink color. If the pink color returns slowly, that could be an indicator of poor circulation. This simple test, known as the capillary refill test, can provide a quick assessment of blood flow to your nail beds. While pale nails on their own can sometimes be harmless and temporary, persistent changes, especially when accompanied by other concerning symptoms, definitely deserve a visit to your doctor. It's always best to err on the side of caution and get a professional evaluation. Don't ignore what your nails are trying to tell you. They might be subtle, but these visual cues can be valuable indicators of your overall well-being. A simple check of your nails could reveal important clues about your overall health, potentially leading to earlier diagnosis and treatment of underlying conditions. Remember, your nails are more than just decorative features. They're a window into your circulatory and nutritional status, reflecting the health of your blood and the nutrients your body is receiving. If you consistently observe paleness in your nails, particularly if it's accompanied by fatigue, shortness of breath, or other unusual symptoms, it's time to get evaluated by a healthcare professional. Early detection of any underlying health issues can make a significant difference in treatment outcomes and overall health management. Take good care of your nails through proper hygiene and a balanced diet, and in turn, they'll help you take care of your overall health by providing valuable insights. Now that we've explored the significance of pale nails, let's move on to the next sign and see what other secrets our nails might be revealing. What if your nails undergo a more dramatic transformation and turn completely white? What could that signify? White nails, different from pale, can be a red flag. If your nails are mostly or entirely white, leukonychia, it could mean something serious. Terry's nails, white with a narrow pink band at the tip, are often linked to severe liver disease. They can also signal heart or kidney failure. Sometimes white nails are caused by a surface fungal infection, which looks chalky and can be scraped off. Rarely, white nails are hereditary, but new changes should always be checked. Kidney disease can cause a half-and-half nail white at the base, pink or brown at the tip. A single white spot is usually harmless, but a whole white nail is a warning. Don't just cover it with polish. See a doctor. Your nails can reveal problems with major organs. Pay attention to dramatic color changes. Next, let's talk about yellow nails. Yellow nails are usually caused by fungal infections. Thick, brittle, and yellowed nails are classic signs. These infections are common in toenails and thrive in warm, moist environments. Treatment takes time as you wait for healthy nails to grow out. But yellow nails can also signal yellow nail syndrome. Yellow, thick nails, swelling in the legs, and breathing problems. This rare disorder is linked to lymphatic and respiratory issues. Chronic lung disease and heavy smoking can also cause yellow nails. Sometimes vitamin deficiencies like B12 or zinc are to blame. If yellowing is persistent, affects multiple nails, or comes with swelling or breathing issues, see a doctor. Don't ignore yellow nails. They can be more than just a cosmetic issue. Look at the whole picture, not just the color. Address the cause, not just the symptom. Now, what if your nails turn blue? Have you ever noticed a bluish tint to your nails? This condition, medically termed cyanosis, can be a subtle yet significant indicator of underlying health issues. Bluish nails mean your body isn't getting enough oxygen to your tissues. Oxygen is transported throughout your body by red blood cells, and when the oxygen saturation drops, it can manifest as a blue discoloration, particularly in areas like the nail beds where blood vessels are close to the surface. This can be caused by lung problems like asthma, where the airways become constricted, limiting the amount of oxygen that can enter the bloodstream. Pneumonia, an infection that inflames the air sacs in one or both lungs, can also impair oxygen exchange, leading to cyanosis. Or a blood clot in the lungs, known as a pulmonary embolism, can obstruct blood flow and prevent oxygen from reaching vital organs, causing a rapid drop in oxygen levels. Bluish nails accompanied by shortness of breath is a medical emergency. This indicates a severe lack of oxygen and requires immediate attention to prevent potentially life-threatening complications. Heart issues like heart failure, where the heart is unable to pump blood efficiently, can also cause blue nails by reducing oxygen delivery to the extremities. When the heart struggles to pump effectively, oxygen-rich blood may not reach the fingers and toes adequately. Sometimes only your hands and feet turn blue, a condition known as peripheral cyanosis. This is often from cold exposure or circulatory issues like Raynaud's phenomenon, where blood vessels in the fingers and toes constrict excessively in response to cold or stress. If your nails turn blue after being in the cold, it's usually harmless and temporary, as the blood vessels constrict to conserve heat. The blue tint typically goes away when you warm up and blood flow returns to normal. But persistent blue nails, especially when accompanied by other symptoms like shortness of breath, chest pain, or dizziness, need urgent medical attention to determine the underlying cause and receive appropriate treatment. Your nails are sending an SOS if they're blue and you feel unwell, acting as a visual cue that something is amiss within your body. Don't wait. Get checked immediately by a healthcare professional to rule out any serious conditions. Oxygen is vital for every cell in your body, and your nails can be the first to show a problem, serving as an early warning sign of potential oxygen deprivation. Always consider the context. Is it just cold weather causing temporary discoloration, or could it be a sign of a more serious health emergency? Take blue nails seriously, especially if they persist or are accompanied by other concerning symptoms. Next, let's look at changes in nail texture, another important indicator of your overall health. Texture matters too. The surface of your nails can tell a story about your overall health. Smooth, healthy nails are generally a good sign, but changes in texture, like the appearance of pits or ridges, can be an early warning signal. Tiny dents or pits in your nails. These small imperfections might seem insignificant, but they can be indicative of underlying health conditions. That's often a sign of psoriasis, an autoimmune condition where the body's immune system mistakenly attacks healthy cells. Psoriasis can manifest in various ways, including skin rashes and notably changes in the nails. Up to half of people with psoriasis have nail changes, making nail abnormalities a common symptom of this condition. These changes can range from mild pitting to more severe distortions of the nail plate. sometimes before any skin symptoms. In some cases, nail changes are the first noticeable sign of psoriasis, appearing even before the characteristic skin rashes develop. This highlights the importance of paying close attention to your nails and reporting any unusual changes to your doctor. Nail pitting happens when inflammation disrupts nail growth. The nail matrix, located at the base of the nail, is responsible for producing new nail cells. When inflammation affects this area, it can lead to the formation of pits or dents on the nail surface. Lots of pits can mean more severe psoriasis, indicating a greater degree of inflammation and immune system activity. The number and severity of pits can sometimes correlate with the overall severity of the psoriasis or risk for psoriatic arthritis. Psoriatic arthritis is a type of arthritis that affects people with psoriasis, causing joint pain, stiffness, and swelling. Nail changes, particularly pitting, can be an early indicator of psoriatic arthritis. Horizontal ripples or ridges can also signal inflammation, suggesting that there may be an underlying inflammatory process affecting the body. These ridges, also known as Bowes lines, run across the nail and can be caused by various factors. Think psoriasis or inflammatory arthritis. Conditions like psoriasis and inflammatory arthritis can disrupt nail growth, leading to the formation of horizontal ridges. These ridges are a sign that the nail matrix has been temporarily affected by inflammation. These are different from faint vertical ridges that come with age. As we get older, it's common to develop fine vertical lines on our nails. These lines are usually harmless and are simply a result of the natural aging process. Another cause, alopecia areata, an autoimmune disorder that primarily affects hair follicles, leading to hair loss in patches. An autoimmune disease that causes hair loss and sometimes nail pitting. In some cases, alopecia areata can also affect the nails, causing pitting, ridging, or other changes in their appearance. Texture changes can be the first clue to a bigger health issue. Paying attention to the texture of your nails and noticing any changes can provide valuable insights into your overall health. Don't just file them down. See a doctor if you notice new pitting or rippling. While it might be tempting to simply file down any imperfections, it's important to seek medical advice if you notice any new or unusual changes in your nails. Early diagnosis can help manage symptoms and prevent joint damage. Identifying the underlying cause of nail changes early on can allow for timely treatment and management, potentially preventing further complications like joint damage in the case of psoriatic arthritis. Your nails can reveal inflammation before you feel it elsewhere. The nails can act as a window into your body, reflecting underlying inflammation even before you experience any noticeable symptoms in other parts of your body. Pay attention to the details. Regular self-examination of your nails and being mindful of any changes in their appearance can help you detect potential health issues early on. Next, what about nails that crack and split? Let's find out. We'll explore the potential causes and what you can do to address this common nail problem. Constantly cracking, splitting, or brittle nails? It's not just wear and tear. Chronic brittleness can signal thyroid problems. Both underactive and overactive thyroids affect nail health. Other symptoms might include fatigue, weight changes, or hair loss. Nutritional deficiencies like low biotin, iron, or protein are common causes. Iron deficiency can also make nails spoon-shaped. External factors matter too. Frequent hand washing, harsh chemicals, and aging all dry out nails. If better nail care doesn't help, look at your diet and overall health. Blood tests can check for thyroid or nutrient issues. Treating the root cause leads to stronger nails. Now let's talk about the most serious nail warning. A new or changing dark line from cuticle to tip. See a dermatologist immediately. This could be subungual melanoma, a rare but dangerous skin cancer under the nail. Not all dark lines are cancer, especially in people with darker skin, but new or changing streaks are a red flag. Dermatologists use the ABC-DEF rule: age, band color, width, change, digit involved, extension onto skin, family history. Melanoma is treatable if caught early, but deadly if ignored. Don't mistake it for a bruise or fungus. Get it checked. A biopsy may be needed to confirm the diagnosis. Most dark lines are harmless, but don't take chances. Early action can save your life. If you see a suspicious streak, don't wait. Your nails could be warning you of something serious. Let's wrap up with what you've learned. That's a wrap on 7 key health clues your nails can show. From color to texture, your nails can reveal everything from vitamin deficiencies to serious organ issues. Don't panic over every change, but stay informed and proactive. Check your nails regularly. If something's persistent or changing, consult a healthcare professional. Early detection leads to better outcomes. Thanks for watching. Stay curious, stay healthy. See you in the next video.